Welcome to today's video. We are so excited to have you. In this video, I'm talking about nursing in UK. Please kindly stay tuned. Thank you for coming back to our channel. And if today is the first time of coming, we love you so much. You're welcome. If you've not subscribed, kindly click that subscription button just down below so that you will be the first person to be notified whenever we post any video. Today, I have another special guest that has been here. Her name is Kobiro. I would have to introduce herself. Hello, darling. Can you introduce yourself to us,
Hello,
please?
hello everyone. I'm Kobiro, and guess what? I'm back again. I'm here to
Yay!
say I have lots of G's.
Yeah.
Stay tuned. We love you guys.
We love it. Amazingly, she has her own channel. What's your
Yeah.
channel's name?
Kobiro Efil Denema is
Hmm.
new, so come and subscribe.
Kindly
Okay.
subscribe, like, comment, and share.
Thank you. We love you.
So let's get into it now.
In UK, any word or wherever you are, you have to do some skills that is particular or
Peculiar.
relevant to that area.
Yeah.
So for me, in a surgical ward, stroke ENT, so we do tracheostomy. So me, I've never done tracheostomy before. So me being really independent with tracheostomy patients was like a new thing, and I was feeling very confident and happy. Like I've learned something new, and
yeah, back at home, tracheostomy is normally done by ICU nurses.
yeah,
I know. Then back at home in my hospital, we do tracheostomy for patients, and ICU nurses do take care of patients with tracheostomy issues. But here in a department, you don't really need to be an ICU nurse to do that. So far, you were trained and you sign up the competencies. You can be able to take care of patients.
and the
on a
tracheostomy they
tracheostomy.
go through ICU first.
Yeah,
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 so they
sure.
do the
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 first,
post op
yeah,
you
post
know
op care
post op care. So when they're a bit better, they will transfer to us.
to your ward, right?
Yeah,
Oh, that's
or a
amazing.
respiratory water. Mine is
Yeah,
not
yeah.
respiratory.
Also, now, the internet has made the world a global village.
Yeah,
Even in nursing, so you can be able to use your internet like teletracking. I've not seen that before. That's really a good one here. Teletracking whereby you need to monitor patient movement, patient transfer. If you need a porter to transfer a patient for investigation, you just have to book it online. The porter will view and see what to do, whether to get a bed or get a wheelchair to transfer patients. It's quite
without like physical like
contact.
communication.
Yeah,
So which
exactly.
is very efficient
It's very, very
for the
efficient.
workplace.
Yeah, it is. Another one is acquisition of skills like signing up some competences. Remember when we
Yeah.
came here, IV, like intravenous
Yeah, we have to do all
cannulation.
of that
Yeah,
again, which we normally do back
yeah,
home.
yeah,
But
it's normal.
you're in a new country, you have to like follow their rules, which is
There
normal.
policies.
Yeah, so 'cause if we want to go to US, for example, or Canada, we still have to follow their rules anyway.
And
So
their procedures,
yeah,
their
so
policies. So nothing is same everywhere, but the policy differs. It
yeah,
depends on what works in each country.
yeah,
Yeah, like I know cannulation is like in a yes here. As a nurse, you need to sign off the competence, even though you know how to cannulate in your
yeah.
previous
That's one
place
of
of
the
work.
cultural shocks that you
Yeah,
have to deal with, but
exactly. You need to learn, acquire the skill, and sign off your computer. Sign it off. Your manager have to
sign as well.
sign as well. Yeah, to make sure that this lady is really good at it.
Yeah, get your manager's blessing.
Exactly, your manager's letter. Indeed. Oh yeah. So another good part of nursing in UK is quite innovative, right?
Of course.
It's very, very innovative in the sense that now nursing has really gone into digital. We have what we call virtual ward, whereby you can easily be monitoring your patients in a space or at home, and the patient is quite sitting or lying in his or her bed at home. The patient, can just give you feedback on what he or she has done,
Of
or
course.
you can also make a plan of the day for the patient by telling him or her this is what you do at this particular time. just like a follow-up care, because bed space in UK is quite a challenging thing for them here, right?
So the virtual work helps to manage more patients effectively.
Yeah.
So which is quite good, and to reduce the wait time on patients. Just imagine if a patient is having supposed to have procedure, so they need a bed space. So they
Yeah.
move them to the virtual ward to give the same care and
Yeah.
effective,
And
which is
effective.
commendable, I must say.
It's quite commendable.
I don't
Yeah,
know
it
how
is.
it works really over there, but I'm sure they're doing a very good job.
It's really a good job. The little I know of it is that I know they have like a television whereby they set up and also set up like a camera in a patient's home, and patient is being monitored. If a patient is going to
That's
win,
amazing.
yeah,
Isn't
if the
it?
patient is
Isn't
emptying
it?
catheter, yeah, it's quite amazing. The patient is emptying catheter, colostomy bag, checking up on patient blood tests. Somebody can go to the patient's house to take blood. Then they'll follow it up, like giving oral medication, certain time, like just like giving the patient a plan of what to do each time, each moment, so as to follow up his or her care at
and
home
which is good
to prevent deterioration.
Yeah, also makes them to be in charge.
Yeah.
Like including them in their decision.
Yeah.
So which is
It's
quite
very
good.
nice.
Yeah.
Very, very nice. Yeah.
Yeah. Which is nice.
It's good. So another good part of nursing in UK is that you tend to see people with good attitude towards work. Yeah. And it's very, very important.
All hands on deck.
On everybody really wants to make sure that patient is getting that quality care.
Yeah, so it's like patient first
Patient first,
for
yeah.
ordinal trust.
Yeah, inner
And
trust.
I must say they're really doing very well, because
are.
I think that's why they have like different specialties where okay, if you know something is not doing working right,
With the
you
patient.
refer. Like if a
Escalate.
patient has like decline in mobility, you can just refer to the physio. They'll help the patient.
Yeah.
The patient needs help as pressure sore and and needs proper care. You just refer to the KBN nurse, that is vibrating nurse. So it all boils down to the MDT team, the multidisciplinary team.
Yeah.
So which is good.
It's very, very good and exciting. The nursing in UK is quite good, and it has its own good pros and cons.
Yeah.
The pros of it, I can say, is quite taxful and stressful, because it is 12-hour stretch shift.
Yeah.
You're always working with documenting. You have a lot of things. Everything you do for patients, you need to document. No documentation.
That's your evidence.
That's the
You did
evidence.
something. You need to show working.
If you don't document anything, it means that you've not done anything for a patient. Even though that the shift was so stressful that you did almost everything, and patients recommended you without documentation. Oh my God, you've done nothing.
So there's no evidence. So
Exactly.
you always need to like document. Like it's not easy, but that's why it's good to delegate. So you have time to document.
And also to shout out for help anytime you need
Yeah.
one.
So let's talk about education. What do you think about education?
Well, in nursing, education is really vital in the sense that each trust, they have their own website, thereby you can embrace yourself with the evidence-based practices and with new procedures that is coming up. Okay, let's just say, for instance, since we came here, we've been doing one learning to another.
Yeah,
every year. Yeah, every year you have to renew your learning.
We normally renew it sometimes every year, sometimes every 3 years.
Yes,
so depending.
Yeah, it all depends. So it's quite good. It's a good side of nursing in UK.
Yeah.
Then
education has some nursing opportunities as well.
Yeah.
Like if you want to be a clinical skills facilitator, like
it's true.
guide new nurses,
Yeah.
CSW in the
PDNs,
trust,
the PDNs. Yeah. The practical development nurses. That's what they call it. Yeah.
So they teach new nurses,
Guide them.
Yeah, just guide them basically. And also we have people that teach OSCE. OSCE is really important for immigrants like us.
It's true. Very true.
So they do the teaching. So if you don't want to do bedside, come to.
Not just that, they also do preceptorship. They do preceptorship. Remember,
Yeah,
we did preceptorship
yeah.
after 6 months of coming,
Some
of being in
people
the
actually
world.
do bedside. That's true. The
Yeah,
CSF.
TSF. Yeah,
Yeah,
clinical skill
yeah.
facilitators.
So we also have palliative nurses.
Yeah,
So what they do is they make patients who have terminal disease,
yeah.
whose prognosis is really poor,
Mm-hmm.
and whenever they declare them, EOL, that's end of life, and
Yeah.
nurse them to peaceful death, and also manage terminal
Illnesses.
illnesses.
Yeah. The goal of the palliative care nurses is just to make sure that the patient is comfortable. Yeah,
Yeah,
it's been given painkillers just to make sure that
yeah,
he or she has a very peaceful death without any
yeah.
stress, without any pain.
Actually, this
It's so emotional,
it's so
right?
I feel like it's so emotional for them.
Yeah, and they're doing a great job. They're doing a
Yeah, they're
great job.
really good. Trust me.
Yeah. So another specialty, we have lots of specialty can specialize in apart from bedside. We have cardiac rehab nurse. Those
Mhm.
they follow patients that have cardiac issues at
Mhm.
home. Also renal failure nurses. Yeah,
Yeah.
we have them as
They
specialties. We
do
also have
dialysis,
dialysis. Yeah,
a lot of things.
yeah, a lot of things,
Yeah.
and also take care of patients that has been diagnosed with renal failure because
Yeah.
kidney issue is one of the things that kills people.
Yeah.
Remember we have different stages of kidney failure,
Yeah.
stage 1, 2, 3,
Yeah.
and
AKI. Yeah.
AKI, yes, acute
Mm.
kidney injury. So they make sure that patient's prognosis is quite manageable even after discharge, right?
Yeah.
So let's have vascular or tissue viability. Normally do is that they
Wound
yeah, they
care.
do
They do
wound
wound
care
care.
basically, and they have
Pressure ulcers.
yeah. They
So
also
basically
educate.
those complicated ones.
Yeah,
Yeah.
complicated one, and they also educate nurses on how to take care of wounds. They have
Yeah.
different items for wound care. A lot of it that you can even aqua cell, silver, like irrigation, water, normal saline. That one we know. We also have soft bandage.
Yeah.
They use different kind of dressing equipment I cannot even imagine. Yeah. So apart from tissue viability nurse,
We
we
got palliative. So
yeah.
what they do is they do calm and peaceful death for patient that EOL.
Mm.
That's for them to have a safe transition to the other world,
Yeah.
or for patients who are diagnosed with
Terminal illnesses.
illness. Yeah, so they
Make
just
sure
help
that
manage their illness
mm-hmm.
better
Yeah, it's
and make
true.
them comfortable. I
Yeah.
think that's the most
Remember the
important
definition
thing.
of
Yeah,
nursing by
yeah.
Virginia Anderson.
Of
They have that. So that
so
is what practically what they do here,
yeah.
right?
Yeah, bless them because their
Yeah, they're so oh my
their
god.
their role is a bit emotional.
Yeah, it is. It's
Yeah,
quite
I don't know
emotional.
how they do it, but they are blessed.
Yeah. Yeah. So in UK, find out that you have a lot of opportunities in nursing that you can really venture into.
Mm-hmm.
Do you know we have digital nursing, like virtual world,
Yeah, yeah,
whereby
that's true.
you can be in just a space taking care of a patient at home,
Yeah,
ensuring that the patient takes
yeah,
their
true.
medication, and
Mm-hmm.
the patient has a website whereby he or she can tell you, oh, this is how I'm feeling. I've
Mm-hmm.
done this. I've emptied my urine bag. I've emptied my colostomy bag. Just like a continuous care for patients. So UK nursing is really vast. I can tell you that.
Yeah.
Nurses, vascular
Mm-hmm.
nursing in terms of they have to do with the blood vessels. Whereby if patient has issue with blood flow through the blood vessels, either the upper extremities or the lower extremities, you just have to make sure that patient is you just have to care for the patient.
Yeah,
It's a specialty of
and
its own.
also vascular nurses, they also like train nurses
Mm-hmm.
for venipuncture,
Yeah, it's true.
cannulation,
VBG, that's venous blood gas.
mm-hmm, and
ABG, arterial blood gas.
peak
Peak
line,
lines, yeah, all these extensive
yeah,
procedures, yeah, it's true. They make sure that we learn how to do, how to carry it out. They also
yeah,
train nurses and doctors too.
and
Phlebotomists, they train them.
yeah,
Even
support workers
support
as
workers,
well.
yeah.
Yeah,
So
because
it's
some of
quite
them do all of that in ED.
yeah in the air accidents and emergency
Yeah.
unit because it's quite demanding, you know. So it's
So
quite a
if
lot.
you want to, transition from bedside,
Mm-hmm.
you know,
To any other
you
nursing,
just
you
need to
can
know that pathway and
yeah
go ahead.
go ahead and carry that.
Do you, my love?
Every time, every day, you need to upgrade your learning and also upgrade your skills as a nurse, you know. So in this country, you find out that you have different kinds of skills to acquire because responsibility differs. So many things in nurses do,
Mm-hmm.
like stomach is being taken care of, right?
Yeah.
Thank you so much for tuning in into today's video,
Thank
and
you. We love you,
yeah, we love you so
as
much.
we know.
Yeah.
As you
So
know.
stay tuned for the next video. Hope
Yeah.
you like it. Take care
Don't
and have.
forget to like, share, and
Oh yeah.
subscribe. And let's know your experience. Let's
Mm-hmm.
learn from
Yeah,
you.
yeah. Let's learn from you in the comments. Just share
Yeah,
your
learning.
experience
Yeah,
and let's know what
learning is
nursing is.
continuous.
Yeah,
So
it's a continuous thing. Yeah. So let's know what nursing is in your own department or your own part of UK. You know, UK is made up of three parts or four
yeah,
parts. England,
four
Wales.
countries.
Yeah, four countries. Sorry, England, Wales, Scotland, and Ireland.
Island.
Yeah,
Yeah.
Ireland. So, guys, thank you so much and have a wonderful
Thank
day.
you.
Take care.
Bye.
Bye.